Welcome back to the deep dive. We're going to tackle something today you guys have been asking about.
Oh, yeah.
Yeah, the connection between mental and physical health.
Okay.
It's something that we all kind of maybe take for granted a little bit. But
Sure.
you asked us to look at this book, the Handbook of Clinical Psychopharmacology for Therapists.
Okay.
And wow, it's got some insights
I bet.
about, diagnosis and treatment and really where these challenges come from.
Yeah, that's interesting because it feels like this whole field is really shifting from how it used to be. It's not just nature versus nurture anymore.
Right.
Like, is it all in your head or is it a chemical imbalance? It's
Yeah.
this interplay. And that's what's so fascinating to me. It's not an either or. They both impact each other.
It's a two-way street.
Totally. Our brains change based on our experiences.
Okay.
But then those brain changes also affect our experiences.
So to really illustrate this, let's get into some of the case studies from the book.
Oh, perfect.
These stories, I think, are just so powerful in showing how biological factors can show up as psychological symptoms.
Absolutely. And one of the cases that I thought was so interesting was Robert.
Okay.
He was this high-powered stockbroker,
Okay.
and it seemed like overnight, just suddenly he had severe fatigue,
Oh, wow.
lost all motivation, just fell into this deep depression.
No.
And it turned out
What was it?
it was a side effect of his blood pressure medication.
Wow.
Yeah, that's why. So once they adjusted his meds, the depression was completely gone, like lifted.
So it's almost like his personality changed
Right.
because of this medication side effect.
Yeah.
And that makes me think, how often does this kind of thing happen?
All the time, probably.
And nobody knows.
That's why it's so important to get an accurate diagnosis.
Yeah.
We're not just, slapping a label on symptoms. We're really trying to find the root cause.
Yeah.
So we can give the right treatment. And even when the root cause is biological, the emotional and social effects of those symptoms are very real.
Of course, yeah.
Robert's depression, it affected his work, his relationship, his whole life, basically.
Well, there's another case in here, Amy.
Okay.
She was a teacher, and all of a sudden she developed this crippling anxiety.
Oh, wow.
And it turned out to be a side effect of a new medication, arthritis medication she was taking.
Okay.
And when she stopped taking it, the anxiety vanished.
Interesting.
Poof.
Gone.
It makes you realize that what we often think of as purely psychological could be coming from a biological root.
Right.
And the book had even more examples, too. Cases where, metabolic disorders were actually the cause of anxiety and depression. Things like hyperthyroidism
Right.
or low testosterone.
So then what about the idea that our experiences can actually change our brain chemistry?
Oh, yeah, that's wild.
This rat study blew my mind, the one in the book.
Oh, yeah, the learned helplessness one.
Yeah.
It's such a classic experiment. Yeah, so they put these rats in a situation where they kept getting these unpleasant shocks.
Right.
And at first they'd try to escape, obviously.
Right. Makes sense.
But then, over time, they learned they had no control over it.
Right.
And so they just gave up.
Yeah, they became withdrawn, inactive, like all the signs of depression in humans.
Right, like classic depression symptom.
And here's what's really interesting. Their brain chemistry matched that of humans with depression.
Wow. So it wasn't just like a behavioral thing.
Nope.
Their brains were actually physically changing because of this learned helplessness.
Yeah.
So, if rats can get depressed because of their experiences, could we learn ourselves into other emotional patterns?
That's the big question, right? I mean, it's hard to say for sure because we can't directly compare rat brains to humans.
Right.
But this research definitely suggests that our experiences can rewire our brains.
Yeah.
And it really makes you think about the importance of therapies that teach us new ways of thinking and behaving.
Well, and talking about therapy, they were saying in the book how psychotherapy, especially for OCD,
Right.
can actually normalize the activity in a specific brain region.
Yeah.
Did you see that part about the PET scans?
Yeah, that was interesting.
So, therapy is not just
It's literally changing your brain structure.
Whoa.
Yeah.
And it's not just about feeling better?
Exactly. It's about making actual physical changes.
That's huge.
I know, right? And we're just starting to understand how powerful therapy can be in rewiring those pathways in the brain.
Okay, so, if our experiences can change our brains for the worse, and therapy can change them for the better,
Right.
doesn't that make early intervention super important?
Oh, absolutely. Which is why I think the concept of kindling that they talked about in the book is so fascinating.
Oh, yeah, tell me about that.
So it's basically the idea that with things like depression, that first episode might be triggered by a really big stressor, right?
Okay.
But then each episode makes your brain more vulnerable to the next one.
Oh.
So you don't need that big trigger anymore.
So it's like your brain is getting more and more sensitive to depression over time.
Right.
That's kind of scary.
It is, but it's also empowering because it means that if we get in there early,
Right.
we might be able to prevent those future episodes.
Right. And that's where I think the idea of an integrated approach comes in. you know?
Totally.
We need to think about the psychological triggers and the biological stuff.
Yeah, it's not one or the other.
Not either or.
They're both important.
We've got to look at how they work together.
Exactly.
We haven't even talked about culture yet either.
Oh, you're right.
And how that plays into all of this.
Well, the handbook mentions this really interesting study about Chinese patients and lithium treatment.
Okay.
So these patients had the typical side effects from lithium like everyone else,
Right.
but they interpreted them totally differently than patients from Western cultures.
Oh, really? How so?
So like Western patients will often complain about increased thirst and urination, but the Chinese patients, they saw that as a good thing.
Like what?
Yeah, they thought it was a sign that the medication was cleansing their body.
Wow, that's so different.
Right, so even a simple side effect
Right.
can be perceived in totally different ways.
Depending on your cultural background.
Exactly.
I think that's a really important reminder that one-size-fits-all treatment just doesn't work.
You're right.
We have to understand the whole person.
Biology, their psychology, their beliefs.
Yeah, everything.
It's all connected.
I feel like we're just scratching the surface here.
Me too.
But it's been an amazing journey so far.
Yeah, definitely.
This deep dive has really opened my eyes to how interconnected everything is when it comes to mental health.
It's a complex tapestry for sure.
Yeah.
And if there's one thing I want our listeners to take away from this, it's settle for simple explanations.
Right.
Ask questions, be curious.
Yeah.
And remember, you're not just a brain or a collection of experiences. It's
Right.
the way they interact, that dance between them.
Yeah.
That makes you, you.
So we're going to take a quick break here, but stick around because in part 2, we're going to actually zoom in on the brain.
Oh, cool.
Right? Literally microscopic.
Wow.
And look at the world of neurotransmitters and receptors.
Okay, can't wait.
It's going to be fascinating.
Awesome. So welcome back to our deep dive into mental health. We've talked about how connected our mental and physical states really are, but now I think it's time to zoom in on the brain itself.
Okay, I'm ready for the microscopic view. I've always been fascinated by how this one organ controls so much of who we are.
Right. It's incredible. We're talking billions of nerve cells, neurons, all talking to each other in this unbelievably complex network.
Yeah, and I remember from psych class that these neurons communicate using neurotransmitters. It's like their own language.
Exactly. It's a chemical language. So these neurotransmitters are released by one neuron. They travel across this tiny gap called a synapse, and then they bind to receptors on another neuron.
So if something disrupts that communication, could that lead to mental health problems?
That's exactly right. And it can happen in different ways, like maybe the neurotransmitters aren't being produced enough or they're broken down too quickly.
Oh, okay, I see.
It's like a glitch in the system.
Right. And I remember from our previous deep dives that there are different types of neurotransmitters, each with its own job.
Right. So, for example, you've got serotonin, which is involved in mood regulation, but it's not so simple.
What do you mean?
Well, serotonin has different types of receptors, and some of them actually have opposite effects. Some are incitatory and some are inhibitory.
So even if you increase serotonin levels, it depends on which receptors are activated.
That's exactly why figuring out the right medication can be such a challenge.
Okay, so it's not just about levels, it's about these specific receptors.
Yes, and these receptors are constantly changing, too.
Changing how?
Well, they can become more or less sensitive depending on things like stress or exposure to medications. It's really complex.
Wow, so we've zoomed in pretty far here, down to the cellular level. But what about the bigger picture, like the different parts of the brain? Which ones are most important for mental health?
Well, one key player is the hypothalamus.
Oh, right. I remember that from Psych 101. It controls things like body temperature and sleep. But how does that relate to mental health?
Well, the hypothalamus is also central to the stress response. So when we sense danger, the hypothalamus sets off a chain reaction.
Okay.
Hormones are released like adrenaline and cortisol, and that gets us ready to fight or flee.
Right, the classic fight or flight response.
Exactly. But the thing is, if we're constantly stressed, it can keep the hypothalamus in overdrive.
And that's not good.
No, it's not. Long-term exposure to stress hormones can damage brain cells, especially in the hippocampus, which is crucial for learning and memory.
So it's not just that stress makes us feel bad in the moment. It can actually cause lasting damage to the brain.
Unfortunately, yes, which is why managing stress and having healthy coping mechanisms is so important.
Okay, that makes sense. So we talked about the hypothalamus and stress. What are some other key brain areas involved in mental health?
Well, there's the limbic system, often called the emotional brain. It's a whole network of structures like the amygdala, the hippocampus, and the cingulate gyrus.
So they all work together to process emotions.
Yes, and they also form memories and control motivation and behavior. The amygdala is particularly interesting. It's like a little alarm system in the brain.
Oh, how so?
Well, it's always scanning for threats and triggering fear responses, but in some anxiety disorders, the amygdala might be overactive, leading to excessive fear and anxiety.
Oh, I see. And what about the hippocampus? I remember that's involved in making new memories.
Right, so if someone has a traumatic experience, it can create really strong memories in the hippocampus that can lead to things like flashbacks and nightmares.
Wow, I'm really starting to understand how mental health isn't just about willpower. It's tied to these complex systems in the brain.
Exactly, and these systems can be influenced by so many things: genetics, stress, trauma, the environment. It's incredibly complicated.
Which makes me wonder about medication adherence. I mean, if it's so complicated, why do so many people struggle to take their meds as prescribed?
That's a really important question, and there are many reasons why someone might not take their medication. Side effects are a big one, especially if they're really unpleasant.
Right, if the medication makes you feel worse, why would you keep taking it?
Exactly, and sometimes even mild side effects can be a problem depending on a person's job or lifestyle. If someone drives for a living, they can't take a medication that makes them drowsy.
So clinicians need to really understand the whole person, not just their diagnosis.
Absolutely. They also need to address any fears or misconceptions about medication.
Like what?
Well, some people worry about getting addicted or becoming dependent on the medication.
Right, there's still so much stigma around mental health, and taking medication can feel like admitting weakness.
That's true, and that stigma can prevent people from seeking help or sticking with treatment. So clinicians really need to be compassionate and understanding.
Okay, so we've gone from tiny neurotransmitters to the complexities of medication adherence. It's clear that understanding the biology of mental health is crucial for effective treatment.
You've got it. This connection between the mind and the body is at the very heart of mental well-being, and it's anything but simple.
I'm ready for the final part of our exploration. Okay, so we've laid the groundwork, we've explored the brain,
Right.
but how do we actually use all this to help people?
Yeah, that's the key, right? It's all about application.
Exactly. So how do we take all this knowledge about the mind-body connection and make diagnosis and treatment more effective?
Well, the handbook really stresses this idea that we have to understand the whole person,
Okay, so not just their symptoms.
not just checking boxes for a diagnosis. We need the whole picture.
Right, their biology, experiences, beliefs.
Exactly, all of it.
And I'm guessing that's not always easy.
It's definitely complex, and the handbook actually talks about these three areas that often complicate diagnosis.
Oh, okay, like what?
Well, first, you might have someone who's dealing with, say, depression or anxiety,
Okay.
but they also have a personality disorder on top of that.
Oh, wow. So it's like,
It adds another layer of complexity.
yeah, like trying to untangle a knot.
Right, and then there's substance abuse,
Okay.
which can sometimes look like other mental health problems,
Oh, so it could mask the symptoms.
or it can mimic them.
Right.
So it's really important to figure out if substance use is part of the picture.
Yeah, because that could totally change the treatment plan.
Absolutely. And of course, having a mental health condition can also increase the risk of substance abuse.
Right, it's like they're trying to self-medicate.
Exactly. And that just makes everything worse.
So what's the third area that complicates things?
Well, the handbook talked about medical illnesses.
Oh, right, like physical health problems.
Yeah, things like diabetes or heart disease, even autoimmune disorders.
And those can affect mental health.
They can. They can impact mood, energy, even how well someone thinks.
It all comes back to that mind-body connection.
It really does. You can't separate them.
Okay, so knowing all this, how can clinicians actually improve diagnosis and treatment?
The handbook suggests a team approach.
Like a multidisciplinary team?
Exactly. You've got psychiatrists, psychologists, social workers, even primary care doctors.
All working together?
Yeah, everyone brings their expertise to the table.
Right, so it's not just one person trying to handle everything.
And they have to communicate.
Oh yeah, that's crucial.
They need to share information, make sure everyone's on the same page.
That's a big shift from how things used to be.
It is. We're moving towards a more integrated system.
Where mental health is part of overall healthcare.
Right, and that integration has to go beyond the doctor's office.
Like, what do you mean?
Well, we need to involve the community, things like support groups and educational programs.
It's about creating a whole network of support.
Exactly, and this brings us back to cultural sensitivity.
Oh, right, we touched on that before.
It's so important because someone's cultural background can really affect how they view mental health.
And how they respond to treatment?
Absolutely, and it's not just about being respectful.
It's about making sure the treatment actually works for them.
Right, it has to fit within their cultural context.
This has been such an eye-opening deep dive.
It has been fascinating.
We've gone from these personal stories to the inner workings of the brain, and now to this bigger picture of how to approach diagnosis and treatment.
And I think the biggest takeaway is that mental health is complex.
Yeah, it's not simple.
We need a holistic approach. We need to understand the whole person.
Mind and body, experiences, culture, it's all connected.
And if you're out there struggling, please know that you're not alone.
There is help available. There are people who understand this and they want to help you.
Keep asking questions, keep learning.
Keep taking care of yourself.
And each other.
Until next time, keep diving deeper.